Hello, my name is Dr. Ayla Wolf. I am a doctor of acupuncture and oriental medicine. And in this course, we are going to be talking about traumatic neck injuries. This is the second course in the Concussion Treatment Series. And if you are kind of just diving into the series, we also have an introductory course to concussions and post-concussion syndrome, as well as a course that gets into the differential diagnosis of concussions from a Chinese medicine perspective, and also covers some assessments and kind of baseline concussion testing that is very common in today's society. So those two courses are recommended prerequisites to this concussion treatment series. The first course in this series focused on traumatic headaches, and this course is going to focus on traumatic neck injuries and a lot of the crossover in symptoms that people can experience from having a combination of a concussion or traumatic brain injury, as well as associated injuries to the neck. The purpose of the Concussion Treatment Series is to really bring to life a lot of the concepts that we talk about and introduce in those first two prerequisite courses, and then really talking about how do we assess our patients, how do we gather important information, come up with a diagnosis, how can we help to educate our patients on why they're experiencing the symptoms that they are experiencing, and then also have a much deeper understanding of how acupuncture and Chinese herbs can actually help these people to heal, looking at it through the lens of applied clinical neuroscience and through neurophysiology. So thank you so much for being part of this treatment series, for taking these courses and having a deeper interest in learning how to help these patients. Because patients with concussions and brain injuries are oftentimes difficult to treat, and a lot of times they have already seen a lot of other practitioners by the time they get into our office. And so at that point, it's really important that we have a really deep grasp of what it is that these people are going through and can offer them a perhaps different perspective and different treatment approach that really helps to get them out of pain and to improve their functioning and quality of life. First, we're going to talk about the physiology of sensory integration and how that is really key in understanding what happens when people have a traumatic neck injury. Traumatic brain injuries and concussions often occur in conjunction with traumatic neck injuries. When somebody has an injury to their brain, there's usually a lot of force that happens that causes the brain to actually move around inside the skull. And we know there's even a rotational aspect of that as well that causes shearing forces and shearing injuries of the axons. We get into that in that introductory course to concussions. But in terms of the force that is required to do that, it also usually causes some kind of stress to the neck as well. And what's important to realize is that both of these injuries, a traumatic brain injury and a traumatic neck injury, can share overlapping symptoms. So what I mean by that is that, for example, if somebody has a traumatic neck injury, and we're not even talking about any aspect of concussion or brain injury, that neck injury alone can create a lot of symptoms that look very similar to a concussion, for example. So dizziness following whiplash or neck injury is extremely common, and it can actually last months to years following the injury. And the reason why I have this picture here of the bridge is that a lot of people, when they talk about their symptoms, they maybe have a hard time finding the right words to describe what it is that they're feeling. But what is very common, like if you've ever walked across a freestanding bridge like this, and you know that when you get to the middle of the bridge is moving and swaying, and it's not perfectly stable. And so you have this sense of disequilibrium, like the ground is moving on you. And that is a really common experience that people have after a traumatic neck injury or a concussion, is that they maybe don't necessarily have a vertigo or a spinning sensation, and they maybe don't even have a sense of lightheadedness or dizziness, but they have a sense of disequilibrium, as though they were standing on a bridge like this, and the bridge is kind of shaking and moving. Because if you've ever been on one of these bridges, and then as soon as somebody else steps on the bridge, the whole bridge kind of starts shaking on you. And that is a very common feeling that these people will have when they're standing on firm ground, is this sense of disequilibrium. So other symptoms that people might use to kind of describe their experience is that they might feel off balance, they might have a sense of rocking, or they might say that they feel like they're floating, and that might be a full body floating sensation, or I've had people also say that they just feel like their head is floating. And some people also say that they have kind of this, a swimming sensation. And so that's the term that they use to describe this sense of disequilibrium. And then other people, again, might just use terms like lightheaded or dizzy. The point being is that when people are using these terms, it's really good to ask more questions and to get more clarification on exactly what it is that they're experiencing, so that you have a better understanding of, is it just that they feel like they're about to faint? Is it that they feel like they are floating? Is it that they are experiencing true vertigo, where there's an actual sense of rotation, where either the world is spinning or they feel like they're spinning? So really important to ask for clarifying questions, and give them descriptions of kind of these different terms to get to the bottom of what it is that they're really experiencing, rather than just kind of saying, okay, they have vertigo, because some people might say that they have vertigo when what they're experiencing is not true vertigo. So we're going to get into some of these definitions as well, so that all of this becomes a little bit more clear. But first, I want to point out again this idea that there's a lot of overlapping symptoms in people with neck injuries and concussions. So a traumatic neck injury by itself, with no brain injury present, can cause dizziness. It can cause headaches. It can cause poor balance. It can actually cause visual fatigue. So a traumatic neck injury can actually impact the visual system as well and cause visual fatigue. And it can also cause changes in depth perception too. Blurry vision and light sensitivity. So again, if you look at this list of symptoms, these are all of the symptoms that are very common in people with concussions and brain injuries, and yet they can also occur without the brain being injured, and can occur exclusively from traumatic injuries to the neck itself. And the reason being is that it all comes down to how information from the neck is being integrated in the brain with all of the other senses. So it comes back to this idea of sensory integration within the central nervous system. So once we understand that, all of this starts to make a lot more sense. So let's talk more about cervicogenic dizziness. And again, to define this, its dizziness is said to be cervicogenic in origin when it is closely associated with a neck injury, neck pain, or neck pathology, after all other causes are ruled out. And so the mechanisms involved in this is that the fact that balance and orientation, meaning kind of where I am in space, relies on the following sensory integration of visual cues. What are my eyes telling my brain? Auditory cues, to say kind of where am I in the world in relation to the sounds that I'm hearing around me. The vestibular inputs from the vestibular system to say, where is my head positioned in space? How is it positioned? And how does that change as I move my head in different directions? And then proprioceptive input from the muscle spindles and the joint mechanoreceptors, especially in the neck. So the brain relies very heavily on what the neck is saying, the feedback that the brain is getting from the muscle spindles and those joint mechanoreceptors in the neck. So that's why if somebody has a degenerative disease in their neck, some kind of degenerative disc disorder, for example, the joint mechanoreceptors will actually start to fire more, and they will give the brain a sense that there is more movement happening in the neck than there actually is. And that sensory mismatch between what the joint mechanoreceptors are telling the brain compared to what the visual system and the vestibular system are saying, when that information is not all lined up and not saying the same thing, there's going to be a sense of kind of dizziness and potentially disequilibrium. So that's the real take-home message here, is that when there are errors of signaling coming from any one of these systems, the visual system, the auditory system, the vestibular system, or the neck itself and the mechanoreceptors in the neck, basically dizziness and disequilibrium can result. So that's really kind of the message that we're going to be spending a lot of time diving into even further. So these proprioceptive signals of the neck muscle and cervical joints play an enormous role in maintaining and fine-tuning the person's orientation at rest and balance while in motion. Alterations in these proprioceptive signals, which could also be called joint position sense, seem to be responsible for the majority of cases of cervicogenic dizziness. So if you've taken some of my other courses where I've taught about testing for joint position sense is simply the ability to determine if somebody moves my finger either into flexion or extension. Can I tell which direction my finger is moving? Or if they move my toe into flexion or extension, can I tell that my toe is being moved in a specific direction? So this idea of joint position sense can be applied to any body part, but when it's applied to the neck, essentially, if we don't have good joint position sense, then our brain doesn't know where we are in space because it's not getting the right information coming from the neck. And so our different senses aren't saying the same thing. And when we have diseased cervical joints, they have a higher concentration of mechanoreceptors in the joints, the ligaments, and the muscle spindles that become hyperactive. So this hyperactivity of the mechanoreceptors as a result of a diseased cervical joint or degeneration in our cervical joints actually means that there's more information, more signaling going to the brain to say that the neck is moving to a greater degree than it is. And so that can create a sense of dizziness, essentially. And so even though this is a course on post-traumatic neck pain, this can also apply to, say, elderly people that have degenerative disc issues in their neck and dizziness. This might actually be the cause of their dizziness. So keeping in mind that a lot of the information that we cover can be applied to even a broader population of people experiencing dizziness. Immediate sustained change in cervical input to the sensory motor control system following neck trauma may be a more common cause of dizziness, visual disturbances, and unsteadiness, as well as changes in cervical proprioception, head and eye movement control, and postural stability. Acupuncture has been shown to improve cervical joint position sense, dizziness, and standing balance. So this paper, was published in 2017, was not a paper on acupuncture, but it was a paper looking at causes of cervicogenic dizziness and talking about all the different symptoms that can arise from trauma to the neck. And they had a brief discussion towards the end of the paper on different therapies that are actually beneficial for cervicogenic dizziness, and they actually mentioned acupuncture, which I thought was really, really cool. And certainly in my practice, I would agree that acupuncture can definitely improve cervical joint position sense, and by doing so, actually improve people's balance, as well as getting rid of their dizziness or their disequilibrium. So that's really why we're going to dive deeper into these mechanisms so that when we're doing acupuncture, we can look at it from this perspective of actually improving that joint position sense of the neck.